Hi, everybody. This is Sky Kirshner back again with a little follow-up from our class the other day. We There was a great question, which was, okay, so if we're not going to be telling the patients what to do, what do we do with all this expertise that we have? And are we just going to listen? And how is that going to work? I thought that was an excellent question, so I wanted to give you a little follow-up here from that question with some ideas, and then a little video that shows how this might work with a heart patient. So, um, let's go to our first slide. When we break down healthcare communications, we notice that there are basically three communication styles that healthcare providers tend to use. One style is directing, another style is guiding, and another style is following. So just to break each of those down a little bit more, to direct is to manage or to lead or to take charge, to give information, to conduct, to prescribe, to tell, to authorize, to take command, to point towards, and to administer. This is very frequently the style of many healthcare providers, particularly doctors and nurses. And the sense is, I know how you can solve this problem. I have the information. I've studied this thing for years and years, like you're doing, and I know what you should do. And that would be great if, as we said before, if it worked well. And in some situations, it works just fine. The patient doesn't know what's going on with them. You're able to diagnose this. You're able to make an intervention that's going to work for them, and they're happy with the intervention. They're going to go home and they're going to do it. Great, problem solved. So when we look at healthcare in the United States, and particularly in West Virginia, we notice an interesting thing happens. Life expectancy in the United States is going down. And it's not because of a lack of information or a lack of great interventions. We have more and more really, really good interventions. The problem is that people are making lifestyle choices that are taking them in the opposite direction. Lifestyle expectancy in the United States, I'm sorry to say, you can see West Virginia and Mississippi, we are tied for the bottom. Lowest life expectancy in the United States. And why is this? Again, because of lifestyle choices. Two of those lifestyle choices, one has to do with suicide, which has been increasing dramatically. Another certainly is the overdose death rate related to opioid and fentanyl and everything else. Are these preventable deaths? Are these behavior related? Well, we see the main causes of death here: heart disease, cancer, unintended injuries, respiration, lung issues, breathing issues, stroke, Alzheimer's, diabetes, flu, kidney disease, and suicide. That's an open question. How much of these are behavior related and lifestyle related? And what could we do to bring more prevention aspects to it? United States citizens are overall less healthy than their parents. And most modern maladies are largely preventable through lifestyle choices, and at the same time, and this is the rub, most patients are looking for medical cures that they have behaved themselves into. Right? We know that there are the 5 healthy habits: eating a healthy diet, exercising regularly, keeping a healthy body weight, not drinking too much alcohol, not smoking. And if you do these healthy habits during adulthood, you can add more than a decade onto your life expectancy. That's from the Harvard School of Public Health. And yet, we don't do that. Patients want healthcare providers to become responsible to fix the problem that they themselves, that we as patients could have prevented. No matter how we mistreat ourselves, patients expect the healthcare provider to cure them. And so how is that for you? I suspect that that's probably pretty frustrating for you. And the way, when we think about how learning MI can help, we notice that The informing, the telling the client what to do style does not work well when it comes to lifestyle changes, when it comes to behavior changes. So in motivational interviewing, we're trying to shift the responsibility for the patient's health outcomes back to the patient. We don't, in motivational interviewing, we're not taking responsibility for what the client chooses to do with their choices, with their life. We're presenting them the options, and we're engaging in a conversation, and usually a pretty skillful conversation that winds up guiding them to look at good choices that they could be making. And that's the key. The word is guiding rather than telling. When we're doing motivational interviewing, taking this guiding style, we're getting much better outcomes, and a bigger plus, or as big a plus, the healthcare providers feel less frustrated and less burnt out. And wouldn't that be nice? So what we notice is that the direct telling style does not tend to work well when it comes to helping the patient make a behavior change. So what would work better? I use the word guiding, and the guiding style would be the example of a motivational interviewing style. To guide is to enlighten, to encourage, to motivate. Not to motivate externally, but to evoke the client's own intrinsic motivation by asking helpful questions that cause them to think about what they're doing. And as I said in the class, what the patient hears themselves say means much more to them than what gets said to them. And when they're talking about why they would want to be motivated, why they would want to be making a change, that's gold in motivational interviewing terms. A guiding style is awakening, it's evoking, it's eliciting, it's evocative. With regard to behavior change, the style, the attitude is, I can help you solve this problem for yourself. I can't solve it for you when it comes to a lifestyle change or behavior change. Only you can do that, but I can help you solve this together collaboratively for yourself. The third communication style is to follow, which is to go along with, to allow, to permit, to listen, to attend, to understand it, to observe. In a following style, I won't try to change or push you. I trust your wisdom about yourself, and I'll let you work this out in your own time and at your own pace. Now, I think that's what brought this question in the class, which was, well, that doesn't sound like what I need to do, because I've got all this expertise. So how do I fit all this expertise in? I showed you the skill of ask, offer, ask. That would be one way to bring your expertise in. But let's look a little bit more at these three communication styles. Directing tends to involve telling and informing. Guiding involves asking and evoking. And following is more listening. So if we think about how these three styles might be combined over a 5 or 10 minute or 15-minute meeting with the patient, a directing style is going to involve much more of the orange-red area here, which is informing, less asking and listening. The questions tend to be related to help me know what information I need to give you. In a guiding style, we see more of a blend, more of an equal weight given to informing, also a lot of asking and evoking from the client their ideas, and listening. Usually the information in a guiding style would happen towards the end of the conversation. And in a following style, very little informing, some asking, and a lot of listening. So in motivational interviewing, we're looking at this style. We're looking at a guiding style to the conversation. I want to, so as you think about this, the way that they researched this was they simply recorded or made transcriptions of healthcare providers' conversations with patients. And they noticed that in the United States, most healthcare providers are doing 70% of the time, 70% of the things they say have to do with informing and telling the client what to do. Only 15% of the time are they asking, and 10% of the time they're listening. Motivational interviewing would say this is part of the reason we're not getting the great results and why in the United States our healthcare is going down, because people tend to not like being told what to do. So the question for you is, what is your style? What is your style currently? And would or could or would you like to adjust it to something that might be more effective? And so your style might be a little bit more like this, but it's an open question. And that would be something to consider. What is your style? What is your blend of how much are you informing, how much are you asking, and how much are you listening? So I wanted to demonstrate this. I've got a 5-minute edit here of this is Steve Rolnick talking with a heart patient, a guy who had a heart attack. We saw a little bit of this in the class, and I just wanted to play a 5-minute clip so you could see what this looks like.
Some of these things we talk about, if I can do them, that maybe my fears of having another one aren't as real.
That's right. They really can help, but I've learned from experience that people aren't always ready to make what can be quite difficult changes, and my job isn't to push you into making changes you're not ready for, but to try and help you work out which ones you might be ready to think about.
Give me some illustrations. What are you?
Well, sometimes we talk to people about their diet. Sometimes we talk to them about exercise. Those are two very common ones. In your case, I know you're a non-smoker, so that's a non-issue, which is great. We might talk about alcohol. It's really up to you. I guess the question is, given the way you are living your life now, can you see any room?
So you see this collaborative approach, right? He's putting out the obvious lifestyle changes, but he's giving so there's his expertise, but he's giving the agenda over to the patient to see which of these the patient thinks he would, one, be willing to do, and which one might be the most benefit for him. Let's go back to the
case. I know you're a non-smoker, so that's a non-issue, which is great. We might talk about alcohol. It's really up to you. I guess the question is, given the way you are living your life now, can you see any room to improve on any of these health behaviors? Or do you feel, no, actually at the moment I'm doing about as well as I can, and that's it for the time being?
Well, essentially my use of alcohol is pretty much a social thing, I guess, and perhaps I need to give a thought as to what substitutes I can have. Sometimes I go a long while to be nothing.
Right. So it might or might not be something that we...
Might or might not. Probably after I've had a hard day, I like when I come home to have a drink before dinner. Maybe I'll talk to my wife and maybe we can use something else to take the place of it. But
the occasional drink helps to unwind after a busy day.
That's the way it has seemed to me to be. And I'm not so sure that one single one does any great amount, but if we're out with a group of people, maybe that's more. I'd like to think about this more and try to see what we can do to. If you think that would be helpful, I'd like to.
Now this is a really interesting moment. If you think it would be helpful, and you'll see what he does. He doesn't let the patient shift the responsibility back on him. He's not going to take that responsibility. He's going to shift it right back to the patient and say, I'm not sure. It's really up to you. Let's see how he says it.
Sure, because I know
Let me
from
take
your
that back.
If you think that would be helpful, I'd like to.
I'm not sure, because I know from your records that you're not a heavy drinker.
No.
And we've got this difficult task of trying to balance out where you're going to make the most gains. And I'm not sure whether it's the alcohol. It might be in some other area. And so that's what we need to do, is to try and have a bird's eye view of all of the different aspects of your lifestyle before leaping into one. Because you might be right. Having one drink after a busy day actually helps you unwind and does your heart good. I mean,
See, I love this. This reminds me of Socrates and the saying, "The beginning of wisdom is ignorance." So he's joining the patient in an ignorance position. I'm not sure. Let's look at this together. Let's see what we come up with. Let's see what you might really be able to do, because the patient himself isn't sure what. And you hear his, well, I don't know, let me think about it, but let's hear how the rest of it goes.
When you talked about diet,
yeah.
Do you have a diet that I have to follow?
It's possible that we can give you one, yeah?
Is it a rigid thing or something I can work with?
Well, my feeling about this is that rather than give you a diet, that the best approach is for you to work one out with us. And we might give you information, but you choose those bits of information that are suitable to you, because that's what's most likely to work. And this afternoon, I wouldn't really like to give you a diet sheet, because I think it would give you the wrong message that I've got to stick to this regime.
Yeah, I guess you made me feel a little better about that, because I've had this diet thing before,
Exactly.
But if you can make suggestions when I come in another time or something, we
can have a look at that.
Yes, we'll have a look at it and see whether or not. Meanwhile, my wife and I will talk about this.
Yeah. And so we might be talking about some small changes to the way you eat rather than a new diet regime.
I think we could probably.
Yeah. So you're keen to do something if it'll help, and if it
because I do have a little fear of this thing and coming back, and if there are some of these things I can do, I'm awfully willing to talk them over with you.
Right, excellent.
Yeah, I'm awfully willing to talk them over with you. I'm not quite sure if I'm ready to do them, but I'm willing to talk them over with you. And so we see the client, we hear the patient's reluctance, and also we're planting seeds, thinking about how to do this collaboratively, what's really going to work for the patient. And you heard, even though he was the one who asked for, could you give me a diet, when Steve Rolnick says, I'm not sure that would be the best thing, he says, oh, well, that's a relief, because I've done that before and it didn't exactly work. Well, I hope that's a good example for you of more of a guiding style. You heard the balance between asking some good questions, being an expertise in how other people prevent heart attacks, but not being an expert in how this patient is going to do it. Only this patient has the expertise to know how he's going to do it. Steve is acting as a resource, giving information about how other people have done this and what the research shows in terms of diet and alcohol and exercise and all those things, things that the patient probably already knew, but having a more in-depth conversation about what does the patient think is going to work for him. All right, so in closing, I want to thank you for your time. Hope that was helpful, especially for the folks that were interested in that question. I'd like to remind you that we do offer free practice sessions every Monday and Friday from 9 to 10 and Wednesdays from 5:30 to 6:30. You can show up anytime. There's no registration. Just come to the website, wv-mi.com, and we'll help you get set up if you want to practice getting better at this skill. Thanks so much, and I hope you have a wonderful rest of the day and a wonderful time in your careers as professionals. Bye-bye.